Good evening, doctors. Our today's topic is spinal nerves, and now I am going to explain you whole plexus and spinal injuries like cervical plexus C1, C5, brachial plexus C5, T1, lumbar plexus L1, L4, sacral plexus L4 and S4. So let's start from cervical plexus C1 to C5. I already written here all the spinal nerves. These are the roots. So C1 gives the two branches like geniohyoid, geniohyoid, geniohyoid nerve, and thyrohyoid, thyrohyoid, thyrohyoid nerve. This supply the hyoids bone and hyoid. It's represented by their own. Then C1, C2, and C3. It gives rises together the three nerves. Like I represent one mnemonic like O, shit, oh shit. This is the mnemonic. So O represent here omo, H represent here hyoid, hyoid, hyoid nerve, omo hyoid nerve. It supplies also the hyoid. And it's sternohyoid, S represent sterno, H represent here hyoid nerve. This is sternohyoid nerve. Okay, then this one is sternohyoid. Another one. Now ST, shit, sternothyroid nerve. And together with all these five branches combines to form ansa cervicalis. Okay, and this sternothyroid supply the cartilage. It supply the cartilage. Okay, thyroid cartilage. Then C3, C4 and C5 combine to forms the nerve phrenic nerve. It gives supply to phrenic nerve, and it innervates like pericardium and diaphragm, diaphragm, and then C5 give rise the rhomboidus nerve, rhomboidus nerve and rhomboidus muscle. It innervates the rhomboidus muscle, and serratus anterior nerve, and it supply the serratus anterior muscle. Okay, then C5 again. It also supply the dorsalis, scapularis. Okay, now it's innervates the dorsal scapula. Okay, then brachial plexus. I already explained in my whole videos earlier, but I am going to explain every spinal cord innervation till here. So now brachial plexus starts. So need to remember brachial plexus. How we are going to remember? Like, remember to drink cold beer. Okay, now remember represent here root, RWT, and brachial plexus C5 till T1. Root, okay, then root is C5, C6, C7, C8, T1. Till T1 it's brachial plexus. So roots, these are the roots. Then remember two it's trunk. So trunk, three trunks here, like UT is upper trunk, like MT it's medial trunk, and LT it's lower trunk. Okay, lower side trunk. Then remember two trunk. Drink means divisions here. So division includes like posterior division. This red one is posterior division, this is posterior division, PD, and anterior division AD, and this one is anterior division, green one is AD, and from here is AD, anterior division. Then this combines together, this red one to give rise, I already told, remember to drink division. Cold means cord. So this one central line posterior division gives posterior cord, give rise the posterior cord, and these two together anterior division combines to form the lateral cord, LC. So lateral cord opposite to the lateral trunk. See, this is opposite lateral trunk and this is lateral cord. So remember by this way. And here the last one, it's medial cord. And how to remember this? From here, UM UMMAR. So now I am going to explain you what does it mean. This is coming from lateral cord. Lateral cord, see, from anterior division, and this is musculocutaneous. Musculocutaneous nerves innervate the deltoid nerve also, and a patient will not able to flex his bicep, elbow. So there is a flexion problem. This is flexion, this is extension. So nerve subscapular is damaged, not able to show his biceps. It's flexion problem. Musculocutaneous nerve, and this is lateral cord. So lateral cord is lateral pectoral nerve, lateral pectoral nerve, and lateral median nerve. Remember this, lateral median nerve. This is median, I represent here. Median nerve. This is lateral median. Then U is coming from by which? This is lateral trunk. This is coming from, so U represent here ulnar nerve. See, U represent here ulnar nerve. And here is lateral pectoral nerve, but here in medial, this is medial cord, so give medial pectoral nerve, and this applies to pectoral muscles. And then lateral medial nerve here, so I'm going to put here medial branch of medial nerve, okay. And two also remaining, like we see another nerve named the medial cutaneous nerve end of arm, it's number 1, and medial cutaneous nerve of forearm. So till here it's clear. Then posterior cord come from the division like C5, C6, C7, C8 and T1. These are the root, and division it's posterior. So it gives A represent here axillary. Ulnar nerve, I already explained. Ulnar nerve injury causes the claw hand like this. Claw hand due to ulnar nerve. And axillary nerve by posterior cord. Axillary nerve. R represent here radial nerve. Axillary nerve injury occurs in surgical neck fracture of the humerus, and radial nerve causes the wrist to drop this way. Have you ever seen like wrist in this way? This is a wrist drop due to radial nerve injury. And what else is superior scapular nerve, suprascapular nerve, and infrascapular nerve, and thoracodorsal nerves. So these are the 5 branches. So brachial plexus is over. Now I am going to come on lumbar plexus. What is lumbar plexus? Lumbar plexus starts from L1 and ends till L4. So in case of lumbar plexus, it's a branch. Lumbar plexus L1, L4. This is L1 give 2 branches like iliohypogastric nerve, and it supplies what? It supplies the hypogastrium supplies. This iliohypogastric come from T12 and L1, and inguinal inguinal supplies the scrotum muscles and scrotum also. Ilioinguinal. Then in case of L1 and L2, it is genitofemoral, genito, genitofemoral nerve. This is genitofemoral nerve supplied by L1 and lumbar 1 and lumbar 2. I saw yesterday 2 patients before surgery. They have a foot drop due to L1 and L2 injury, genitofemoral. Okay, and it supplies the femoral muscles. Okay. Then L3 includes here L3 include here genitofemoral. It's posterior femoral cutaneous nerve. Posterior femoral cutaneous nerve. In case of lumbar plexus, this is anterior from L1. It's anterior division. Now I forgot to explain you cervical. This one, this part omohyoid, geniohyoid, it's hypoglossal nerve. Hypoglossal nerve, which is cranial nerve 12. It supply mainly the tongue. See the tongue? This side, this tongue, it will supply by hypoglossal, is a 12 cranial nerve. Okay. Then what else? From accessory, this side, accessory, ACCESSORY, accessory nerve. This is cranial nerve number 11. This is cranial nerve number 11, and you need to remember by this way: OATS, oats. It's to supply the lesser occipital nerve. This is occipital, and now it supply the skull muscles. This occipital. Then A represent here greater auricular nerve. This A, auricular, it supply the outer ear. Then T, transverse cervicalis. Okay, and this is supraclavicular nerve. This supply the clavicle bone. And this transverse cervicalis, my dear friend, it supply the neck, cervicalis. See, till here it's clear. Now left is sacral plexus. Sacral plexus from L4 and S4. This is the posterior division from sacral plexus, and this one is the anterior division. Anterior, I'm going to write. And this start from L4. So from here till here. So how to remember? This I already make some trick. Quick, see, quick. First one, quick, fast. Operating. It's a trick. No need to think. It's a quick. Operating. Postpartum. There is partum. Postpartum consumption. Okay. So quick. Which nerve is it? It's quadratus. Quadratus femoris nerve. And operating, it's obturator internus nerve. And this post represent here posterior femoral cutaneous femoral nerve. Posterior femoral cutaneous nerve. I hope I need to check out this. Wait a minute. And this S3 I represent here from S1 L5 L4 quadratus femoris, from S2 S1 L5 obturator nerve, and from this S3 S4 femoral posterior cutaneous, and its partum pudendal nerve. And its consumption, I am not sure, from S4 and S5 branches give the coccygeal nerve. And this partum pudendal give rise the nerve which is known as pudendal nerve. Okay, and it's really clear for you. And yeah, here it's posterior cutaneous nerve. And we see already here, this is lateral. This one is lateral. Sorry, my dear friends, this is lateral femoral cutaneous nerve in case of lumbar plexus. So how to remember L and lateral femoral cutaneous? But here also cutaneous femoral, but here is posterior. Post I already written, so L lateral in case of lumbar, but in case of sacral it is posterior femoral nerve. Okay, consumption coccygeal. So till here anterior it's clear by my trick. We can say coccygeal nerve. Okay, and this pudendal nerve supply the levator ani muscles also, and this is obturator muscle, quadratus. Okay, then posterior part. It's very easy. Superior. We are going to learn superior gluteal Gluteal, it supply the gluteal muscles, okay, superior gluteal minimus, and it is inferior from S2, S1, L5, it's inferior gluteal nerve, and then it's piriformis from 2, S2 and S1, piriformis nerve. So my dear friends, piriformis supply the piriformis muscles, and gluteal, inferior gluteal supply the gluteus maximus muscles. So my dear friends, I already explained very easy way how to remember all the spinal nerves, and I am 100% sure it cover the anatomy. It's a very huge topic. I explained in a so easy way, and orthopedics also, what now injury, and it's very helpful. So it's really good. So I want to invite my friend, please came here and say thank you for online viewers, those who are watching us. Thank you my dear friends, those who are watching online. Okay, if you still not subscribe my channel, please don't forget to subscribe it, and please put like my video, and if you have any questions, if you want to study anything, you can ask me. Have a good day, good night, take care, good